Hello, everyone, and welcome back to the 24 Hours of Rare. We are now in hour 21. We are privileged to have Dr. Nazi from Georgia here. She will be speaking about GSIEM. Dr. Nazi, welcome. It's such a privilege to have you here, and I'm going to turn the stage over to you.
Okay, thank you so much. Hello, everyone, and thank you so much for having me here as a speaker. It's my privilege to be with you to join 24 Hours of Rare. So now I'll share my screen, and here we can start. So my topic for today is rare disease in Georgia. My name is Nazita Batadze. I'm a pediatrician from Georgia and founder of GSIM. So it's a Georgian Society for Inborn Error of Metabolism. We established it just 2 years ago with decision to become a part and a member of SSIM. So this society was established by a team of doctors. Here I present the members of team, and we are working in Medical Lab Georgia. It's a clinic in Tbilisi, Georgia. So Georgia is country, Georgia, not state, Georgia. Here I'd like to emphasize the main task of our society to increase the awareness of rare disease in our country, to improve the knowledge and interest in inborn error of metabolism and raise awareness about newborn screening, to set up some network of physicians who could provide care of patients with rare diseases, support international collaboration and diagnostic possibilities, and support all families who are impacted by rare diseases. And the main goal is to improve quality of life and increase social interaction of all patients in Georgia with rare diseases. So it's the map of our country. Georgia is like a small country. It's the interaction of Europe and Asia with population up to 4 million. So we are a small country. Now I'd like to let you know two words about newborn screening here in Georgia. Just 3 disorders are screened here, and state program covers 3 metabolic genetic disease, PKU, congenital hypothyroidism, and cystic fibrosis. Here I mentioned some statistics. So all newborns born in Georgia, all child born in Georgia can be screened for this disorder. So no other disorder are in our state program, and it's not easy to diagnose rare disease, to diagnose, monitor, treat, and so on. Because of this, our team organized nice collaboration with Archimed Life in Vienna. It's a lab in Vienna, and if we have any suspicion of patient with rare metabolic genetic diseases, we can send samples there and do some investigation. And thank you, Zam, so much. There is no local lab here in Georgia to do metabolic disorder screening, some metabolic investigation or genetic investigation. So for the moment, for present moment, we need to send samples, and we need collaboration with the metabolic and genetic laboratories. So otherwise it's a good chance for our patients to have our collaborators, because we can make diagnosis. We can, if there is any suspicion, we can do investigation beyond our country, but otherwise we can. So we are trying hard never to miss treatable disorders. We organized our society, and we have some web portals. So we're translating information about metabolic disorders in Georgian. We have some blog for patients and for doctors. So we are trying to create brochures or information papers for patient families and doctors to raise awareness. Sometimes it's not easy for patient families to have information in English. So we are trying to have all this information in Georgian. 2 years ago, Georgia became the part of International Society for Neonatal Screening. We have willingness and we want so much to widen the screening program, to add one or maybe more disorders in our state screening program list, but I think it's not easy like in countries like Georgia. So we need to assure the government, or the government needs extra money, and it's not easy, but maybe we can organize to do some pilot project, and after that the state maybe can include some other disorder in the screening program. Let me mention about Genzyme, Sanofi Genzyme and BioMarine project in Georgia. Thank you them so much. So if there is a patient with this disorder, we can offer them to do laboratory testing and even genetic testing to confirm Fabry disease, Gaucher, Pompe, MPS, and steroid lipofuscinosis. So last year we had a nice meetings with doctors from different parts of Georgia. So we have webinars, presentations to let them know about key symptoms, presentations of this disorder. So even patients not from capital of Georgia, we can do screening for all those disorders. So it's really a great opportunity and a great project here. Now we can move on to other disorders. Let me share our experience about Fragile X Georgia. 3 years ago, our team of doctors, we did pilot project here. Fragile X testing, and we could test 250 patients. So they were children from 3 to 15 years with diagnosis of intellectual disability or autism-like features. And we have 11 positive results. So 10 was full mutation Fragile X patient and 1 was premutation. So after our project, we connected to NFXF. It was Robin Miller first who supported us. So we shared our information that we are a country, Georgia. We did some project and how to proceed, how to do more regarding Fragile X. He invited our team in Belgrade. It was a great conference where autism and Fragile X associated disorder. Me personally was there. And I have an honor to meet in person with the whole team, Fragile X team. So they supported us so much, and last year we established Fragile X clinic, Fragile X Center here in Georgia. Now patients from Georgia and even surrounding countries can come to our clinic to do medical or other services, to have all services regarding Fragile X. Our team are actively involved in translating all materials regarding Fragile X as well. NFXF supported us so much. So now Georgia is in the map of Fragile X Community Foundation, and we're so proud. Here is the information about Fragile X Center, Tbilisi. It's in our clinic in Medical Georgia. In this year, we cannot communicate with the parents and families in person, but we had quite good meeting, online meeting. This is the peaks from our last meeting. The next meeting will be in March, and the parents from US will join us, and we will have like joint meeting, and it will be great chance to share experience. Our Georgian patients have lots of questions, so we are waiting for the next meeting with US families. Now let me tell you about CDKL5 Georgia. It was several years ago we published a nice paper in Epilepsy and Behavior. It was about our patient and special seizure types and treatment option of our patient with CDKL5. Our French colleagues supported us so much. Genetic testing was done there free of charge, and all authors of these articles were involved in diagnostic and treatment of our patient. Here they are, 5 kiddos with CDKL5. So they like gathered together. We now are like a family. We established a foundation, CDKL5 Georgia. We had regular meeting, how to do, how to be, what steps to do together. And now I'm very happy to say that CDKL5 Georgia is a part of CDKL5 Alliance. So we became the member, and our families are there. So we were invited in CDKL5 forum. It was a great chance for us to meet like the parents and doctors and investigators and scientists. It was nice meeting. So here is Georgia on the map. And it was really a good chance to do further steps for our CDKL patients. The next step was a Marinus study, ganaxolone study. So 2 patients with CDKL5 Georgia were involved where there was not possibility to establish site here in Georgia for them, but these 2 patients, they're included in the site in Poland. So CDKL Alliance and Marinus supported them to be there to visit Poland for studies, and we were included there. Unfortunately, because of COVID pandemic, this study is stopped, but I do hope, and we all hope, that we can go on with this medication. Here is our team with the physicians and patients and families together. And here is Olivier Dulac, our French colleague, child neurologist. He's our great friend and supporter. So it was like an event we created to raise awareness about CDKL5 Georgia. Here are our patient with Dravet syndrome. So CDKL5 was the first association organization, parental organization, and after that was Dravet. Dravet as well, we established a parent organization. We know each other, we have meetings, so we will be the part of Dravet syndrome Europe soon. And hope we will have opportunity to be included in all studies of what is in a Dravet Foundation pipeline. Let me introduce our kids. They established Angelman Syndrome Foundation. We have very nice Angelman Syndrome Facebook web. Some days ago, we together celebrated International Angelman Day. Last week, we have a week about ketogenic diet in our clinic in Medical Lab, Georgia. So actually, in our clinic, we have the Center of Ketogenic Diet. Lots of patients are involved. We have several patients actively involved in ketogenic diets. Here I present some pictures from them. Here is the center, our center of ketogenic diet. So if the patient needs to do to start ketogenic diet, our team can support them and can start it in our clinic. It was our 2020 Area Disease Day in Georgia. It was our first step in this field. Our society organized this day first time last year, and we have Anna Mingoranza with us. So it was really a great chance to know from her about news in rare disease treatment and management. So our patient, our families had opportunity to meet with her, share her experience. So it was really a great day. This was our events for this year, and it was yesterday we had great event. We have some hybrid conference. Some of parts of our parents and doctors gathered in our clinic, Medical Lab Georgia, and some of them joined us with a Zoom call, and it was really, really amazing, very emotional meeting. So at the end of the day, in our plan was Tbilisi TV tower illumination. So we did it, and you can see it was illuminated in rare disease colors. So all of us, we were looking at it, and like we were so happy to be together. And to be back to the main task and mission of our society, we need to do a lot. There is not easy to be a patient with rare disease in our country because of poor access of investigation, poor access of treatment, and it's not easy to be involved in international studies. So we, as a team of doctors, team of physicians, are supporting them. It's their first step in rare disease field, and I do hope together we can do steps, and we can be strongest. So thank you so much once again. It was great to be with you, and thank you once again, 24 hours of rare, to let me be with you. Thank you. Thank you.
Well, thank you. We do have a couple of questions. Thank you for your presentation. Thank you for your time here today. You talked some of the things about, new labs starting up, and what resources are you in most need of in where you're at?
Actually, we have poor resources here. As I mentioned, we have not local lab to do investigations because of, I do not know, maybe a willingness of physicians or maybe support of state. But as I think, we cannot wait to have some support. We better to do some steps. Because of that, I mentioned pilot project. Maybe it will be the best and wise way to start and after that show to the states that yes, we need tandem mass spectroscopy, we need some local lab to start these investigations, and to give the chance of our patient to be diagnosed and to be treated in Georgia. Several of our patients we leave Georgia. They have diagnosis of organic aciduria, amino acidopathies, and so on, but we just diagnose them, started treatment, and after that we need to leave country because there is no support, and all of these charges patient and family need to do from the pocket, and it's not easy.
Thank you for sharing. Also, what do you think the rare disease landscape will look like in Georgia in the next 5 years? That's quite a ways out, but what do you see happening?
With us, there is Rare Disease Foundations. They too are actively involved in raising awareness. So yesterday's day and today's day is really very important to raise awareness. So I think the next 5 years, it will be much more informative and much more interesting and focused on the rare disease the rare diseases. So we will try hard to do this.
Fantastic. Well, thank you so much for your time today. We really appreciate it. We really appreciate your participation, your presentation. Look forward to stay connecting with you, and we wish you the best in Georgia.
Thank you so much. Hope the next year I can present much more news and that I can share much more and nice events here. And thank you so much once again.
Thank you. All right, everyone. Thank you for watching this presentation. At the top of the hour will be an hour 22, and we will be hearing from the Kingdom of Bahrain and also from Kenya. So thank you all for your time here watching 24 Hours Rare. Dr. Nazi, thank you again, and we will see you at the top of the hour.
Okay, thank you.